Hello, you are welcome to today's class, and we are continuing our lecture series on the topic demography and social statistics in public health. That is PHS 223. And today we'll be talking or treating lesson topic 4, which is health needs and health planning. Health needs and health planning, still under the major topic or course demography and social statistics in public health. Quickly, let's have a rundown on what we'll be treating. One, we're talking about assessing health needs based on demographic data. And number two, we're looking at integrating the demographic factors in public health planning and policy. And number three, we're discussing how demographic data influences health planning. Well, you can see a schematic infographic diagram picture by the side talking about step one, that there's a need to be assessed, and step two, you identify and then you prioritize what exactly needs to be done. And step three, that's where you set your goals and then you do your objectives. And step four, you develop your strategy, precisely your policy plan, and then go about implementing step five. And step six, after you have implemented, it's important that you monitor and evaluate what has been done, if it achieved its purpose or not, or perhaps there are things that need to change. Okay, so let's take this course content one by one. Everything we've talked about is summarized in step one. We're talking about, is summarized in step 1 to step 6. So take note: step 1, 2, 3, 4, 5, and 6. So everything that you've seen here, we're dealing more about it as we discuss on. So let's look at it in detail, beginning with introduction to health needs and health planning. Health needs assessment is an essential component of public health. It serves as the foundation for identifying unmet health needs that you find within communities and helps guide the allocation of resources and the development of appropriate health policies. And so, as you can see from this introduction, it's very essential that you carry out a health needs assessment in any community, and it's a major component of public health because it will help you to guide scarce, to guide the allocation of the scarce resources and also bring about development of appropriate health policies that are needed in the community. So in place of health needs assessment, I will simply say HNA. So HNA integrates both quantitative and qualitative data such as demographic characteristics, the health behavior of that population, and also the health outcomes, and together it shape the health intervention that is planned for that population or community. And the data used in health needs assessment come from a range of sources, and they, like we've told you before, talk about demographic data, some of the places you can get them or how you can get them in terms of methodology. Number one, surveys, health records, census data, and mortality records. Now, to provide a comprehensive understanding of the population's health needs, you need this kind of data. Need this data, and once you get this data, you clean up the data, then you prioritize the information you need, then you can utilize those prioritized information. A well-conducted HNA will ensure that the health interventions are not only relevant but adequately equitable, so it can go around the population without anybody having to have a setback in terms of what they get, or having an unpleasant situation where a group of people complaining. No, it will be equitable, it will go around, and it will meet the need at the end of the day. So let's say the first one, assessing health needs based on demographic data, assessing health needs based on demographic data. Under it, we'll see the first aspect, demographic data sources, and then we'll now see the health status assessment. So first of all, look at the data sources, and then we'll look at the health status assessment, how it is done. So let's go into it in detail. Demographic data forms the core of health needs assessment. It provides insights into the composition and trends of a population that directly influence the planning and allocation of healthcare services. Now, key sources of demographic data include number one, census information. Census information. And when we say census information, we simply mean the regularly conducted census that we all know because it provides accurate data on the size and distribution of a population, and it's characterized by the age groups and the vital events like births, deaths, and this data will help identify regions that may be underserved in terms of health care. The next one under the data sources is vital events data. Vital events data. Now this consists of information about births, deaths, marriages, and migrations, and they will help track demographic trends and identify the areas where health interventions might be necessary. For example, a high birth rate in a particular region may point to the need for maternal and child health programs. Let's see the third one, surveys and health registries. Surveys and health registries. You also get data from there. Surveys such as demographic and health surveys, which is known as your DHS, provide detailed insights into health, behaviors, the risk factors in that population, and disease prevalence, which will enable more focused intervention. Now, the health registries, on the other hand, provide longitudinal data that you can use, to compare over a long period of time, even when they were young, and then they became adolescents, became teenagers, and then they became adults. If they still live in that particular environment, of course, they visit the hospital, the health registries have their data, and over the time they come to the hospital, they have their card, a family card or individual card. So it's a longitudinal data, and this longitudinal data, it's very good on specific conditions such as cancer or diabetes. Such pattern shown on how these persons have been managed, how this person has been cooperating to the treatment that has been given, or what step has been taken by the health officials, or maybe in case of vaccine, in case of immunization, and all those kind of data. Now let's see key demographic indicators. This is another data source, another source of data. Now this key demographic indicator indicates data like age, fertility rates, mortality rates, and also gender distribution. And it will help to highlight particularly the health concerns, because it will be specific, and it will be specific about that demographic, about that population. So it will be easy to know that, okay, this is the particular challenge that this community or population suffers from. For example, high infant mortality rates may indicate the need for better prenatal care. It may indicate the need that, look, we need to step up on the level of prenatal care provided or vaccination services provided. Similarly, aging populations, if you find out that a lot of them in that population are aged persons, that will determine or give us a signal that we need resources that is specific for the elderly, to care for them, geriatric care, so that we keep them fine, help them move around, and help them find life still very interesting. And the last one is health status assessment. So that's the second aspect that we'll be dealing with under assessing health needs on demographic data. So we have seen the data sources. We have seen the data sources. Number one, we have seen the census information. We have seen vital event data, surveys and health registries, key demographic indicators, and we have seen those aspects as regards the sources that sources of data. Now let's go to health status assessment. Now under health status assessment, health needs assessment rely on two key types. So in other words, there are two types of needs that help to give a comprehensive understanding of any population set. For one, take is the normative needs. The normative needs, and then the felt needs. That's number two. The normative needs. The normative needs actually is based on expert judgment and professional assessment, while that of the felt needs is based on the perception of the population or the members in that community. So combining both types of need provides a comprehensive view of a population's health. Now, in detail, normative needs, if we have to look at that one by one, these are determined by expert judgment, like I've told, and public health data and professional assessment of what constitutes a necessary health service for a given population. And these needs are generally grounded in clinical knowledge and public health objectives. So you carry out research, and then questionnaires are given, fill them, and then we look at it. An expert looks at the whole result and the whole data supplied, and he makes a conclusive inference based on his knowledge as an expert over the years, and that becomes into a kind of assessment. However, the second one, which is the felt needs, from the word felt, these are the perceptions of the community members. They have a say. Yes, they have a say in what is perceived, in what should be tendered for the authority about their own health status and the types of services they believe are necessary. They let you know, they tell you that, look, this is the problem we have. We need water, we need this, we need that, we need nurses, they let you know because they firsthand know the problem that they are facing. So this needs may not always align with what the clinical expert thinks. It may not always align to what the professional thinks. However, this definition of health are very important from the side of these members of the community because they represent the population's lived experience. That's in terms of people who live there. They are the ones who live there. They are the ones who understand the day to day. The expert only visits probably once in 6 years or once in 4 years. He can't be in a very good position completely and totally, and in fact 100% give a full assessment of that community. So because of that, these people represent the populations, they have the experience and they have the concerns. However, a combination of both the normative and the felt needs will provide a balance of health requirements. So we allow the professional to look at it, give his own expert, and they will also go to the community, ask the ballet, ask the king, we ask the local government chairman, we ask the health representative, the public health personnel, and so on, the market women. When we ask them, the clergymen and all that represent a community, we get the view from the representative of the boys, representative of the men and the women and so on in that community. Now have an expert conclusion to, and together we develop an assessment that both sides, were represented and will have a better formulation. For example, in India, the 2001 census revealed significant difference in health outcomes based on geographical and socioeconomic factors. For example, we have some regions that had a high rate of maternal mortality and poor access to healthcare services, while some other regions didn't have the same problem. And the data that was gotten in 2001 census highlighted areas of urgent need for maternal health services and healthcare infrastructure improvement. And the government swung immediately into operation, ensuring that disparity is. So those are the very benefit of combining both the normative and the felt needs. So let's move to the second one, integrating demographic factors in public health planning and policy. So that's the second aspect under this lesson. So let's look at it together. Now, what are the key demographic factors in planning? We'll be looking at the population size and growth, looking at the age structure, looking at socioeconomic factors, and then take a case study. So let's look at that quickly. The integration of demographic factors is central to public health planning, and these factors determine not only the current health needs of a population, also it shapes the future health trends. So some of the key demographic factors that influence health planning include: one, population size and growth. And why? A growing population means an increasing demand for healthcare services, including hospitals, clinics, and preventive programs. Larger populations require larger healthcare infrastructure, which need to be expanded accordingly to maintain service delivery and quality. Number two, we have also the age structure. Those are the key demographic factors. Age structure. The age distribution of the population provides critical information on which healthcare services are most needed. For example, a youthful population, like I've told you before, may require more maternal and child health services, while an aging population will necessitate greater investment in chronic disease care because it is a major problem, elderly and geriatric services and long-term care facilities as well. So you see, the constituent or the prevailing data for each economy, each population will determine the services that is drawn to that particular population specifically. Let's see the third aspect, the third key demographic factor, the socioeconomic factors. Now, socioeconomic conditions are strongly correlated with health outcomes. Populations in low-income areas tend to have poor health outcomes and face greater barriers to accessing healthcare. Public health planning must consider these disparities and target resources toward populations that are facing socioeconomic challenges. So we look at this fact. In all of this population, which persons or which population is having a deficit in socioeconomic privileges. So we have to now see how we can move those target resources towards that population. Now, if you don't do this, that population will suffer decline, and the disparity will be much, and a lot of persons will migrate to the other area that is of an advantage. Now, let's see a case study. In UK, a particular health district, there was an assessment that was done on coronary heart disease services, and it revealed that areas with higher socioeconomic deprivation used services like revascularization less, despite having a higher need for these treatments. Now, these findings was indicative of accessibility issues related to cost, transport, and healthcare availability. They have this problem. Now, the healthcare has it in place, provide for them, but unfortunately, because of issues of cost, transport, and healthcare availability, they couldn't utilize it. They couldn't utilize it. Whereas they need the revascularization, yet they used it less, and yet they have a higher socioeconomic deprivation in that area. So you see, there is a need to have such kind of data, because when that data arrived, it was possible to now look into that direction. So the study now suggested that healthcare policies needed to address these barriers by improving access to care in disadvantaged areas. So transportation was provided, the cost was reduced, good road networks to access those clinics are now available. So that's the beauty of key demographic factors when they are in place in terms of planning. So let's see the third one, how demographic data influence health planning. How demographic data influences health planning. Number one, targeting health intervention. And then we'll see the second one, number two, influencing public health policies. Now, in terms of targeting health intervention, remember we are talking about how this data influence health planning. And now we want to look at targeting health interventions. When you have a good data, demographic data, it will help you target good health intervention that is equitable. And the primary advantage of using this demographic data in health planning is the ability to target interventions very effectively. Take note of that, effectively. For example, a country with a high infant mortality rate can prioritize maternal and child health intervention, such as prenatal care programs, giving them immunization campaigns, and then good nutritional programs so that these women will know how to feed their children. What conditions? Not that they'll be eating a particular food all the time. A balanced diet there, they know how to put together so that these children can be well nourished. Now, a region with high rates of non-communicable diseases in its aging population can focus on other interventions that are aimed at reducing risk factors for diseases like diabetes, hypertension, and cardiovascular diseases. Why? Because this region, high rates of NCDs, need this help. Now, we also see that these interventions may include lifestyle modification programs so that they will not expose themselves unnecessarily to these NCDs. They will need health education and they will need better management of chronic conditions. Areas with high migration rates may require programs that address migrant health. And the more people are coming into this place because to that population, because that population seems to improve. There is infrastructure, there is socioeconomic factors, and they see that the governance is a very stable one. People will begin to there. So there will be a need to address these migrants as they come in, which could include mental health service, that's mental health services. Let them know that you may have been bastardized where you are coming. Some of you, maybe they've lost their families due to war or famine, and that has really affected their psychology. So they need mental health services so that they don't bring the aggression to the country. They don't become hostile out of fear, and any little interaction with the citizens or people who live in that country will not make them flare up. So these are very services that can be. And don't forget also infectious disease control. Some of them are common diseases in the last 6 months during the war, in the breakout during the crisis, and they've not been treated, and it has really metamorphosized into advanced stages. You have to treat those kind of people, and you have to control that disease, and also integration, international health program. So now that you are allowing them in officially, legally, you now have to do some paperwork to make them feel at home. Not that they get into that country and they are seen as plague, they are seen as problem and maltreated. That way they become hostile, and in a bid to defend themselves, they become criminal. And these are things that need to be put in place. With a very demographic data, you can assure that interventions will be targeted and these needs will be met. So by tailoring interventions to meet the specific needs of different populations, health policies and programs become more effective and can achieve greater outcomes. Okay, so let's look at the issue of resource allocation as part of the influence of good demographic data in terms of health planning. So number 2, apart from targeting health intervention, let us see it brings about resource allocation. So demographic data is indispensable in resource allocation. It ensures that healthcare resources are distributed in a way that matches the needs of any population. For example, areas with high rates of chronic diseases might require more resources allocated to long-term care services and specialized treatments, while regions with a younger population will benefit from a stronger emphasis on vaccination programs and also maternal health services. So proper resource allocation not only ensures that funds are used efficiently, but also ensures that healthcare services reach those who need them the most. It helps to avoid the inefficiencies of under or over resourcing certain sectors. So it will be balanced. You know where to take these two or where not to take that too. And there will be equity. When we mean equity, it means that the right persons get what needs to be gotten, and in the right size and in the right proportion to avoid waste. Another influence of demographic data is number 3, influencing public health policies. Influencing public health policies. Now, demographic trends significantly influence public health policies, and for instance, you find in a country with a high prevalence of infectious diseases, they might, prioritize vaccination programs and disease control measures for them because they've seen that there's a high prevalence of infectious disease. So we need to prioritize vaccination programs, and we need to also bring in various strategies to control the disease. Whereas a nation with growing elderly population, like I've told you before, a focus on policies that are related to taking care of the elderly and also disease management because they are majorly associated with such. Now, similarly, if demographic data shows a rise in mental health concerns among young adults, it could be because of maybe addiction, vices, and all that. Such a population will need a clear focus. It will need a clear intervention. It will need a clear impact that may be designed to increase access to mental health services, thereby to reduce the stigma and provide early interventions in schools and communities. So we know that's where we'll find the youths, and maybe they are into addiction, and we'll go there and begin to do a lot of public campaign, public speech, public awareness, and then we try to pop through security where these things are exchanged, drugs and so on, where they are sold, where they have their windows or their corridors, where these transactions take place. Be arrested, the importation, the ban to it, and also once they can't put ban to the high tax regime, so that to discourage the purchase of those illicit drugs. We've seen also that apart from resource allocation influencing public health policies, and we also want to look at the possibility, if these policies are put in place as a result of demographic data influence, we'll notice that the policies will easily be adaptable because it is not falling from the sky. There are policies that have been developed as a result of findings in the population, data that have been gathered from that population. And so adapting policies to the demographic profile of the population, governments and health organizations can be more effective in addressing the most pressing health issue in any particular population. So it is key that we apply this demographic data, and now that we have sources, we have seen the influence, and we have seen what it can do. So in conclusion, the use of demographic data in health needs assessment and planning is fundamental. You know what it means when we say it is fundamental? We are simply saying that it's something we cannot do without. It is fundamental for shaping effective public health intervention. And therefore, by understanding the population's characteristics, healthcare providers can better tailor services. It can better allocate resources. It can better design policies that addresses both the current and future health needs of that community. In fact, integrating demographic factors ensures that the public health strategies are properly targeted, they are properly equitable, and properly sustainable. Ultimately, it will improve the health outcomes and minimize the disparities across different nations. I believe that you've learned a lot today, and we have extensively talked about the topic health needs and health planning. And so you can see from the infographic here of health planning, and it says it brings about a better health score, and then you can see it will improve the goal and the targeting. And here you see that when you take up the proper health planning, you see it lead to action plan, and these are part of the lifestyle like as you can, like I've explained, diet, lifestyle, improved living, and so on. So I'll see you in the next class. And the next class, talking about the topic that will be population mobility and its health sequences. Population mobility and its health sequences. Don't forget, take your notes, pause, play till you understand. And if you have any question, do well to send it to classroom platform, and I will attend all questions when I see you in class very soon.